Okay, well, thank you to everyone who's joining us for this conversation today with Dr. John Nkengasong, who is director of the Africa Centers for Disease Control and Prevention. So today we are talking about all the efforts underway to ensure access to COVID-19 vaccines to populations across the African continent, as well as the challenges that lay ahead, include importantly, ensuring equity and dealing with the new variants of the virus. As we move forward with the discussion, please put any questions you have to Dr. Nkengasong in the Q&A function of this Zoom call. But first, I'd like to welcome Racy Mushilua, who is the head of Sub-Saharan Africa at Novartis, who is going to provide some opening remarks for our discussion.
I would like to welcome everyone to today's event. Following the onset of COVID-19 pandemic and its spread worldwide, there has been a shortage of diagnostics, medical supplies, and essential medical equipment, such as the personal protective equipment for healthcare workers, face masks, ventilators, and many others. Many African governments have had severe challenges procurement of essential supplies to support their response activities, and they face stiff competition with the more industrialized countries for the limited resources available. As an organization, Novartis Sub-Saharan Africa is excited to be part of the solution in supporting public-private partnerships to help alleviate supply and logistical constraints. And one way we are doing this is our collaboration with the Africa Union Initiative, that is the Africa Medical Supplies Platform, where we are supplying a basket of medicines for management of COVID-19 symptoms. I look forward to hearing the latest updates from Dr. Nkengasong on how the continent is tackling the crisis. During the pandemic, we also witnessed a rapid uptake of technology-driven healthcare solutions. For example, artificial intelligence has been used to model the spread of disease, improve early detection, improve the triage of patients, and accelerate the development of novel therapeutics all around the world, including Africa. This is why I've been happy to see Novartis Foundation launch the Health Tech Dialogue Hub with Devex. The hub hosts events such as tonight's discussion and other articles and publications that together aim to help transition emerging health techs innovation into impactful, far-reaching solutions that improve the health of populations around the world. Vaccine equity is a big concern across the world, more so for developing markets. And I look forward to hearing Dr. Nkengasong as we examine what's next as Africa moves towards and forward with the largest vaccination campaign in its history. Once again, I welcome all of you to the event. Thank you very much.
Thank you so much, Racy, and thank you to Novartis for helping to make today's event possible. So the Africa CDC is a relatively new agency established in 2017, and it was very much thrown into the deep end at the onset of the pandemic, where it had to manage a series of very difficult challenges, including working to get essential supplies to the continent amidst price hikes and the breakdown of supply chains. Dr. John Nkengasong has stood out as a public globally for the ways in which he has managed the response in Africa, receiving numerous awards and other acknowledgements. Dr. Nkengasong, thank you so much for joining us for this conversation. First, can you give us a bit of vaccine update? So the COVAX facility started shipping doses to the continent in late February. How many countries are rolling out vaccines at the moment? And do you have a figure on how many doses have been provided?
Yes, thank you, Sarah, for the kind introduction and for inviting me to be part of this conversation. And I don't know if you hear me. Can you hear me well?
I can hear you well.
Okay, great. And I think, first of all, let me repeat what I've said over and over, that the COVAX facility represents, to me, a great symbol of cooperation, global cooperation, and also a symbol of global solidarity that we have been talking about, and should be actually promoted and encouraged. And so we are very, as a continent, very pleased to see that the first wave of vaccines, mainly from the AstraZeneca supplies, are beginning to arrive the continent. As we speak, as of last week, about 19 countries have received vaccines from the COVAX facility, and we hope that that process will continue to cover the entire continent, which is a continent of 1.2 billion people with 55 member states. We also know that the COVAX facility is designed to achieve a 20% coverage for the continent, a continent of, as I said, 1.2 billion. And we as a continent have established a threshold of at least 60% of our population to be immunized, so that we can achieve that level of immunization in the communities that would enable for herd immunity. So that leaves us with a gap right there. So the gap there we're looking for to cover is at least 40%. And if, of course, COVAX increase their supplies on the continent, we will, that gap decreases as well. So because of that, the African leadership has also established the African Vaccine Acquisition Task Team, so that we can continue to work towards achieving our goal of at least 60%. So that is where we are today. And now countries that receive the vaccines, some are beginning to roll that out very speedily. Countries like Rwanda are making very good progress with almost using all their vaccines. Some are beginning, but I think it's work in progress and very early days.
Okay, great. Thank you for that. What do you foresee as kind of the coming challenges in the months ahead? What worries you most about this rollout, and kind of having challenges already in countries that are concerning to you?
Sara, we use a simple equation at Africa CDC, which says vaccines plus vaccinations equals life saves. And so that is a simple equation that speaks to the two elements that must be looked at. First of all is the vaccine access. Our doses need is about 1.5 billion doses of vaccines to achieve the threshold that I indicated. And we have to do that in at least 2 years to achieve an appropriate level of protection that will be critical enough for us to win the war against COVID-19. So the number one challenge there is, how do we get those doses of vaccines in a speedy manner and at scale, so that we can at least by the end of 2021 immunize at least, I would say, up to about 30% of our population, if we have to have a chance of being ahead of the curve. So that is one. If you now get the vaccines, then you shift to the second part of the equation, which is the vaccination rollout. As you said in your introduction, we will be embarking or have already started a journey that is unprecedented in the history of maybe Africa, or in the history or modern history since independence. I don't recall that we have ever been able to vaccinate about 200 million people on the continent of 1.2 billion people. So that exercise will be an unprecedented, a historic effort, which will require all kinds of partnerships. So what do we need? We need to have the ability to transport vaccines through cold chains. We need to have the ability to train and deploy vaccinators. We need to have the ability to be able to have a good record and database that can actually track those who have been vaccinated. Remember, most of the vaccines, with the exception of Johnson & Johnson, are 2 doses. We need to be able to have a record that tracks people to come back and get their second dose. And of course, we need to work with the community more, so that the community creates that demand and also creates that trust and a level of ownership of these efforts, because the battle will be fought and won at the community level. So those are 2 sets of things that we worry about every day. i.e. to summarize, acquiring enough vaccines and then deploying the vaccines at scale, I must add.
Okay, thank you so much. And now if we could talk about AstraZeneca. So there's a lot of news around AstraZeneca. First of all, concerns about the effectiveness of the vaccine against the strain of COVID-19 originally found in South Africa. And you said before that government should not roll out the vaccine if that variant is dominant in a country, specifically dominant. And there are also concerns about whether the vaccine is linked to blood clots. But this is the vaccine most countries are receiving through the COVAX facility. So how should African nations manage that? What should they do with the AstraZeneca vaccine?
That's a very good question, Sarah, and a very topical question, because all of this week, you've heard a lot in the media about many countries in Europe suspending the use of that vaccine. Let me just put that in context for Africa, that there are about 78 countries in the world that are using the AstraZeneca vaccine. So it's not just restricted to Africa. And a handful of countries in Europe have decided to pause the use of the vaccine while ongoing surveillance or investigations are going on. So we have two sets of recommendations. One is with respect to the variant. We saw from the data generated in South Africa that the variant, especially the variant that was identified in South Africa, had a knock-off effect on the vaccine and in terms of neutralizing antibodies. So our recommendation at that time was, and is still the same recommendation, that if that variant is predominant in a country, you will be wasting vaccines, and we don't have enough vaccines to be wasted. So, but we have to distinguish that conversation from the safety component, which is to say that upfront, I should have started with that the vaccine is entirely safe. I think that is one. So what do we mean by a variant be dominant? You do not just collect a few specimens from people and then say 100 people, and you found out that one individual has that variant, and you say we are not using it in that country. It has to be a monitoring activity, what surveillance activities that are done almost every month, so that you see the shifting patterns of the variants in the country as you deploy your vaccines. I think that is what, so our recommendation still stands, that besides South Africa and those countries that have seen a shift in terms of the frequency of the variant, we need to continue to roll out they use the AstraZeneca vaccines in countries that do not see that predominant case. A good example would be Zimbabwe, where they have had a shift in that variant very quickly over the last couple of months. So that is one. With respect to what we are observing this week, we have, and last week, so to say, our recommendation is clear. I think we align with the WHO recommendation, and also the European Medical Agency's recommendation that the benefits of this vaccine associated with the use of this vaccine outweighs the risk of the vaccine, period. And we say this because of all the evidence that have been generated in Europe through the European Medicine Agency and, of course, with the WHO. We, as a continent, had a meeting on Tuesday, a meeting of all experts across the continent. There were about 260 people that attended that meeting through our routine, what we call the African Task Force for COVID-19, to review the situation. And that we were also joined at that meeting with the European Medical Association to look at the agency, I beg your pardon, to look at and review and discuss the data. We came out with the same conclusion that the AstraZeneca vaccine should continue to be rolled out. The benefits outweigh the risks. And that if you look at the approximately 17 million people that have received the vaccine, and about 30 have signals that maybe, and just maybe associated with the vaccine, it requires that we use the vaccine. I'll say this and conclude on that point, that COVID has killed over 2.6 million people in the world. And in Africa, it has killed about 108,000 people. And we don't know of any deaths that have occurred because of vaccination. So we are putting in place a surveillance system to continue to monitor the post-vaccination events. WHO is doing that as well. And just on Tuesday, they told us that they have looked at about 800 people that have received the vaccine in Africa. Of that, they pool a subset of about 1,110, look at them carefully, and nobody had manifested any of those signals. So that is where I will leave that topic.
Okay, thank you. I'm going to take a question from the audience. So the question is, while many African countries have done an excellent job at implementing public health measures to slow the spread of COVID, I appreciate hearing how the Africa CDC is approaching the COVID pandemic in Tanzania, given the lack of cooperation there.
So I can answer that briefly, that if a country doesn't collaborate and cooperate with us, we continue to use different channels to offer technical assistance to the country. And we have made it very clear that very early on last year in February that we needed a coordinated approach, we needed a collaborative approach, we needed a communicative approach, and we needed to be sure that we coordinate our efforts as much as possible. Tanzania is a member of the African Union, and the number one principle of the African Union is the unity and the spirit of coordination and cooperation. So we still remain hopeful that Tanzania will come around and work with us, work with the World Health Organization and other partners so that they can receive the appropriate support that is required to at least get them fight this pandemic.
Okay, got it. Thank you. And could you talk a little bit more about kind of what pharmaceutical companies can do to make sure that across the African continent have equitable access to the vaccines?
So pharmaceutical companies, if I heard you correctly, let me just go back for 1 second into my formula of vaccines plus vaccinations equals life saves. There's a unique opportunity there for pharmaceutical companies to join forces and contribute in the entire effort on both sides of the equation. It could be on the side of supporting countries to acquire vaccines, or it could be in the area of delivery, vaccine delivery. I think at any rate, countries will benefit a lot from any efforts from the private sector with the distribution of vaccines, which, as I said, it is going to be a historic effort, unprecedented in nature, to be able to achieve our targets in a record time.
So you testified in front of the U.S. Congress yesterday, and one of the things that you said was that the COVID-19 pandemic would have a tremendous impact on HIV/AIDS efforts. Could you talk a little bit more about that?
Yes, I said that very deliberately, and today at around noon time, I was privileged to meet face-to-face with the executive director of UNAIDS in my office, and the centrality of our discussion was still around that, was around the negative impact of COVID on HIV/AIDS programs and other endemic diseases that we are challenged with on a daily basis, including tuberculosis and malaria. In our discussion, it emerged that if we did not control this pandemic early enough, our AIDS programs are going to suffer significantly, and including an increase in the number of deaths, I mean, what we call excess deaths. We know that each year in Africa, HIV/AIDS kills about 500,000 people on the continent. It is very possible that that number in terms of excess deaths, maybe up to about 200,000. So I think it's definitely going to have a significant effect on HIV/AIDS program, which we're making a lot of inroads into that, significant progress in that area. Now, why is that happening? People are reluctant to go to clinics. People are reluctant to go to hospitals. Supplies are challenged because the supply chain management, the global supply chain management is very integrated. So if you, so they are not distinct commodities only for COVID and for HIV, the commodities are all integrated, so that it begins to challenge the whole process. So that is why, again, it brings us back to the question of the need to vaccinate quickly. So this is not just routine vaccination where we take 10 years to get vaccination, but if we really want to win the battle against COVID-19 and protect the HIV programs, protect the TB programs, and protect the malaria programs and the immunization programs, we need to roll out vaccines in a very speedy manner.
Okay. In one of your previous responses, you talked about tracking mutations and the importance of that for rolling out vaccines. So there are many countries on the continent that don't have the capacity to genome sequence, which is the technique used to track virus mutations. And Africa CDC and WHO have regional networks that help countries to track this, but still there are about 40% of countries who haven't submitted data yet on the mutations. How worried are you about kind of the effectiveness of the regional networks and the ability of countries to track mutations?
No, that's an excellent question. Unfortunately, we had anticipated that genomic sequencing would continue to play a central role in the ability to fight a disease outbreaks. And this was in 2018, where we launched the African CDC Pathogen Genomic Institute in partnership with the Gates Foundation. I remember at that time we were speculating that there might be one day outbreaks or pandemics that will require that. Fast forward 1 year later, exactly 1 year later, the pandemic showed up. So we're fortunate now that we already had a structure in place through the Pathogen Genomic Institute of the Africa CDC. So what we have done is to work out an arrangement or organize ourselves into 3 levels on the continent. Level 1 are what we call the specialized labs, okay, the APEX, and where there are about 3 labs there, Christian Happy's lab in Nigeria, there are 2 labs in South Africa, one of them run by Professor Tulio. Then underneath that are what you call the regional labs. Okay, the regional labs are those that will serve a subset of countries in each region of Africa. And then underneath the third layer and the last layer is the countries, individual countries that may have the capacity, but do not have enough capacity to support other countries, but they can be supported by the regional labs. And in case the need arises, they move it to the specialized lab. So that's how the continent is organized to respond to this issue of the challenge of sequencing. As we speak about through the network, we've been able to supply about 8,000 genomes into the database. And our goal is to be able to sequence 50,000 genomes from now to in the next 10 months. Okay, so that we continue to have a full understanding of what is going on the continent, especially given that we know the impact of genomes on the deployment of vaccines. So it's work in progress. Let me just say this, Sarah, that this is part of strengthening health systems. And you do not strengthen health systems when you need them. You strengthen health systems before you need them. So we find ourselves where we are building the ship and riding the ship at the same time, which is not very easy.
Okay, thank you. So we got a question from the audience, the barriers to local production of vaccines. I know there's been a lot of conversation over the past year about kind of the need for the continent to produce its own vaccines, but there are a lot of issues like funding and the questions around the long-term demand for the vaccines in the future and kind of the sustainability about that. How optimistic are you that there will be broad-based manufacturing of COVID-19 vaccines across the continent? And do you see it as a full production or kind of the end of the process packaging production?
So there's a lot in that question. I think we have to approach that from the perspective of how do we build back better? How do we build that boldly? And how do we build back bigger in Africa? So it's not just enough for us to come out of this crisis looking the same as we went into the crisis. How did we get into this crisis? We went into this crisis with Africa, a continent of 1.2 billion, importing 99% of its vaccines, 99% of its vaccines. And we know that vaccines are a huge herd security assets. We also know that vaccines are a huge asset for development. I think if you don't have healthy people, you don't have wealth. We also went into this crisis as a continent, not being able to develop diagnostics or produce diagnostics on the continent. That's why when we started these efforts last year, we launched a partnership to accelerate COVID testing called PAC. And at that time, we were testing only about 300,000 people on the continent. And today, we are close to 40 million tests conducted, which is a remarkable progress. Now, back to the issue of vaccines. If we have to come out of this pandemic looking different and in the spirit of being bold, bigger, and better, we have to do three things and do all of them simultaneously. One is to ensure that we reverse that narrative that we are importing 99% of our vaccines and begin to shift the needle back somehow by encouraging and incentivizing continental manufacturing of vaccines in three different areas. One is have the ability to do the finish and refill. Second is have the ability to repurpose some of our current vaccine producing companies and sites, like the Pasteur Institute in Senegal and others in South Africa, to begin to produce vaccines, COVID-related vaccines. And thirdly, invest in a long-term strategy, which would actually means that we invest in using domestic financing and other funding to guarantee that there's enough research and development on the continent that will lead to the production of vaccines. I mean, Africa do, of course, as you're aware, produce a lot of animal vaccines. And if we can do that as a continent, then something tells me that it's a question of a goodwill, political will, and political commitment to raise the appropriate resources and focus in that area to be able to manufacture vaccines on the continent. You also required appropriate partnerships with the bilateral bodies like our Friends of Africa, partnerships with foundations, and partnership, of course, with the industry to transfer the technology. I think that's what we mean by building back bolder, bigger, and better.
Thank you. So we just have a few minutes left. So this will probably be our last question, but one from the audience is, countries all over the world have been dealing with vaccine hesitancy. What strategies has the Africa CDC employed to combat hesitancy and build vaccine confidence throughout the continent?
So that's a very good question. We had an opportunity very early on to give a lot of thoughts on the vaccine hesitancy concept, and which is real. I mean, it didn't start today. I mean, that whole concept of the ability of the community to not naturally move towards vaccines has been there for a while. So we did a study across the continent, across about 15 countries, to understand what the lay of the land was. And we were encouraged to see that about 60 to 90% of the countries that we surveyed, 15 countries, were indicated that they would take a vaccine if the COVID vaccine in this case was safe and efficacious. Is the situation still the same today? I don't know. We'll continue to assume that it's a dynamic process, the vaccination will start. And when people see that large number of people are being immunized and they do not come down with the side effects and they are not harmed by the vaccines, my assumption is that many more people will go to the vaccination centers to acquire vaccines. It is the only way that will bring this pandemic to an end. I want to be very clear with that. As a continent, we have done very well in bringing down beating down the spread of the virus in the first wave, and the peak was last year around July, August. We bent the curve nicely. The second wave came up around December, January. We bent the curve nicely, and now we are beginning to see that some countries are moving towards the third wave. There's not much you can do with in terms of eliminating the pandemic by just using public health measures. You have to have vaccines. Okay, I'm encouraging the continent to continue to adhere to the public health measures, including the constant use of masks, social distancing, avoiding large gatherings and other events that will facilitate the transmission of the virus. We have to remember that the virus is transmitted via human movement and behavior. That is one. We also now need to know that without vaccines, we cannot continue to go in waves and succeed in eliminating the vaccines from the continent. So I think that is what we have to do as a continent, is to come together in the spirit of the whole of Africa approach and get the vaccines, get our people vaccinated, and all of us on this platform and outside of the platform must play a central role in increasing the vaccine confidence. We all know that vaccines are safe. Vaccines have been safe over the years. All of us, or most of us, have used vaccines as a means to survive without several immunizations from measles, from yellow fever, and other diseases. I'm sure I personally would not be alive. I'll be happy to get my first shot of COVID vaccine once it's available.
Okay, well, thank you. We've unfortunately run out of time, but thank you so much to Dr. Nkengasong for joining us to discuss this very important issue. And thank you to everyone who tuned in. And if you haven't already, please consider signing up for our new weekly global health focused newsletter called Checkup. So we shared the link to subscribe to that in our chat function. So please do join us for that newsletter. So it's on everyone's radar. Our next event is on March 31st, where together with Novartis Foundation, we will be looking at the role of technology to ensure cardiovascular health in the COVID-19 era. So again, thank you to all who joined us, and have a good evening or rest of the day wherever you're located.
Thank you.